Hey everyone, John here. This is my 21-month post-op update since I had VSG surgery down in Tijuana, Mexico, at Obesity Control Center with Dr. Ariel Ortiz. Stats. My highest weight back in June of 2016 when I started my pre-op diet was 330 pounds. The day of surgery was September 13th, 2016, and I was 281 pounds. And today I'm 155 pounds, 0.9. So 150, basically 156 pounds. I'm thrilled. I've never weighed this little in my total teen and adult life. So I was probably in elementary school when I weighed this little, and probably just for a hot minute. So, I still continue to lose a little bit. I am trying to be on the more maintenance mode because I think I'm about as thin as I should be. Although psychologically, I think I would really like to be fluctuating. I want to be in a 5-pound radius, kind of safety zone. So psychologically, I would think I would like to be between the 150 and 155, but I've told myself that I probably really should be the 155 to 160 is probably the range that I should really start and maintain because I am getting very bony and I have a Fitbit scale and it says that I am exactly 20.0 percentage body fat. So only really, according to the scale, only have 31 pounds of fat in my body, and I have 124, 25, somewhere around there, lean muscle mass. And 20% is what the goal that my nutritionist had given me. So I think I'm kind of where I'm at. So we'll see. We'll see if I can I'm switching gears and focusing more on, trying to focus more on lifting weights versus cardio. I'm still doing cardio a lot. It's hard for me to give that up. I want to kind of keep that as part of my natural routine, and it feels good. I enjoy it. So, but I'm trying now. I was doing an hour and a half on the elliptical. So this week I actually did. Well, today I only lifted weights. I didn't do any cardio at all today because I ran out. My day just came out time, and I was okay with that. Which before I would have gone on the cardio and not done the lifting. But yesterday I did 45 minutes of cardio and then a half hour, 40 minutes of lifting. And the day before I did an hour. So I am kind of backing off a little bit and kind of seeing where I'm at and how my body's adjusting. I kind of am looking for that sweet spot of, where am I? What do I need to do to maintain versus lose? And so we'll see. It's a whole new learning curve. And I'm also I don't know. I was kind of doing a modified, well, I don't even know modified. I never even really looked up the intermittent fasting. My back doctor had kind of sort of briefly told me about what his friend was doing. So it just said, it was a very quick summary, 2-minute conversation of what his friend was doing. And then I just modified that. So I was like not having my first meal as you know, my first meal is a protein shake, but I wasn't having my protein shake till after 3 in the afternoon. And usually it ended up being about 4 or 5 o'clock. And I always made sure that I got my workout done prior to having that, because someone had said, try and get your cardio done before eating your first meal, so that it's burning fat, stuff like that. And so that was kind of my routine, getting the last probably 15 or I don't know if it was 20 pounds doing that, maybe 15 or 20 pounds. The last 15 or 20 pounds, that's how I got it off. So this week I also have kind of graduated to, okay, I can have my protein shake or, a tablespoon of peanut butter. Peanut butter is my go-to, as you guys all kind of know. I kind of snack on that and use that Excuse me. Sorry, I got an itch. Kind of use that as my go-to for protein and to kind of just get something in my stomach and, satisfy me. But so today I actually was hungry, and rather than just going to go work, because normally when I would get hungry in the mornings or early afternoon, I'd go work out and then, to have my shake. So today I actually had a couple tablespoons of peanut butter at probably about 12:30 or 1 o'clock. So before I even worked out. And then I did end up having my protein shake after I lifted weights because, make sure I get my protein in there. So kind of just playing around with it and kind of graduating to, okay, I can have breakfast and lunch in normal times, I think. We'll see. Kind of see how things go. I'll keep you guys all posted. I mean, I love being able to say that I'm in the 150s, and I know that's a psychological thing. But it's kind of where I think I really want to stay. I really want to try and maintain the 150s, whatever that is. I don't care if it's 155 or if it's 159. I just want that. I want kind of the 155 range gives me that little bit of cushion to, for the 2 or 3 pound weight gain that I usually tend to have on weekends or when I'm going on vacation or something like that, if I'm letting loose and not doing the thing. So we'll see where this maintenance is going to see. I am definitely going to, I'm researching plastics. Definitely have to have my arms done. I'm definitely going to get that done, whether it's, end of this year or beginning of next year with a tax return or something. And so I'm kind of researching, but the first thing I'm going to do is the arms and possibly do the combination of the chest and the whole upper body lift. I think if I go down and get that done in Tijuana, I can get basically the chest and the side, so basically the full upper body lift for what just my arms would cost here in the States. So we'll see. So that's my update. Routine, I'll kind of, still doing the whole protein shake as my first meal. And I don't know, it's time to back to graduating to, 3 to 4 ounces of protein and a veggie or a fruit for lunch, and then same for dinner, and then the Quest bar. Still have my Quest bars at night. I was not necessarily doing my lunchtime 3 to 4 ounces of protein with a veggie. I was kind of doing more kind of like a peanut butter or a yogurt. And then I was just doing a dinner. But now I think as the maintenance is kind of trying to graduate to the, more routine of a breakfast shake which will probably be around noon. I've never been at breakfast. And then, maybe a lunchtime afternoon meal, and then dinner and the Quest protein. I kind of have a feeling that's what my maintenance is going to look like, but we'll kind of see. 4 days of lifting, and then 5 days of cardio, maybe switching down to 4, but even just, I was normally a 7-day, so switching down to 5 is a big step for me too. So that's kind of where we're at. I will update you guys as I progress. Hope all is doing well. Those researching, please do all your research, do whatever you need to do, and go get healthy. Go out and do one thing right today and every day, and then at the end of the year, you're going to do 365 things right, which is a lot. So thank you all for listening, and we'll talk to you in a month or so. All right, take care.